Good morning, my viewers. Thank you for logging in. Thank you for viewing our channels. If today is your first time of logging in, we want to encourage you to look at our previous edition. Last week we spoke about ulcer. My name is Alex Besheko, your usual host. Today we are talking about asthma. Asthma is a management disease. Asthma is not a disease that can be cured. We need to understand that. And so if you have been diagnosed to be asthmatic, you need to pay close attention to drugs that have been prescribed to you and to avoid some things to be able to reduce mortality. A lot of people are dying from asthma. We don't want that. Asthma can be managed and you live your normal life and you'll be fine. And so what are the things you need to take care of? That's why we are here. As an asthma patient, you need to know your trigger. What is a trigger, by the way? Trigger is anything that even start the asthma symptom or make the asthma symptom to get worse. So you need to avoid this trigger. It can be from exercise, strenuous exercise. It can be from pollens from flowers. It can be from smoke from the kitchen, from tobacco. It can be from dust, also from viral infection. Whatever thing triggers this asthma condition needs to be avoided. So once you have established that, you have gone a long way in even stopping asthma attack. Now let's talk about medication. Now, as I said, I'm not going to mention any kind of medication here, but because I believe you are already on one kind of medication or the other. But the fact is that inhalers are the best way to manage asthma. Inhaler. Some people take tablets. It's not that helpful. It will not really help to, manage the situation optimally, the way we want to get a good result from this asthma issue. So now you need to be on inhaler. But what kind of inhaler do you need to be on? There are two types of inhaler. We have an inhaler that is a reliever, and we have inhaler that is a controller. Now, the controller inhaler is what you are supposed to take every day. Either you are fine or you don't feel fine about your asthma condition. You need to be on this controller inhaler. What it does is that it reduces the swelling and the inflammation in the airway, that narrows the airway, that makes you not to be able to breathe well, and which comes up when you have issues of triggers, and then you call it asthma attack because you feel choked, you can't breathe, you feel a lot of burden in your chest and all of that. Now you need to take the controller. The controller will help you to avoid this condition. Now, what I see is that a lot of people are rather on the reliever. They take the reliever, often. You are not supposed to be on the reliever. The reliever is supposed to just be by the side, just in case there's a need for it. So you may not even need to use your reliever for a year or two. The fact is that if you are using your controller inhaler, which is a inhaled corticosteroid, it will help to prevent attack. And that is the point here that I want to emphasize. Please talk to your prescriber, go to the pharmacy, go to your to the clinic and let them know that you have this information. What do they think about it? If you are not on inhaled corticosteroid, it's necessary. That is the standard requirement. That is the guideline, that is recognized worldwide, that an asthma patient needs to be on a controller. We can't be carrying the reliever around and be waiting for asthma attack to happen. No, you don't have to wait for the asthma attack to happen. Prevent it, as we know that prevention is better than cure. Another thing to take note is how to use the inhaler properly. Please, you have to be sure you know how to use it. If you don't know how to use it, just watch demonstration on YouTube on how to use the inhaler, or walk into the pharmacy, talk to your pharmacist. The pharmacist will be kind enough to demonstrate how to use it, because it's important to get the right dosage. It must be discharged properly so that you achieve the dose for the day. By that you'll be able to have the protection required for the day. So please do this. And again, rinse your mouth after each use to avoid mouth ulcer, because it's a steroid. You don't want it to remain in your mouth and cause mouth ulcer. Rinse your mouth properly after each use. Thank you, everyone. Thank you for your time. Thank you for listening. Share my video, like my page, subscribe. Let somebody that have asthma get this video and watch it and take the important notice. When we do it right and everybody is doing the right thing, you can be sure death will be minimal, if not eliminated completely. Thank you.